my name is Harley Agard. I am going to be doing my presentation on why keeping the nurse to patient ratio safe is very important and the benefits that come from that. So a little background history, kind of why I am doing it on keeping the nurse to patient ratio safe is I actually do work in healthcare right now. I am a CNA. I have worked in rehabs, care centers, and right now I'm actually working in a hospital and a doctor's office. So healthcare, it's kind of always been a part of my life, I guess you could say. And I'm also going into the nursing program, hopefully in the spring. So that's another thing why I did my paper on this. So I'm going to be starting off with my opposing articles, and my first one is why the legislature opposes the nurse to patient ratio being fixed. And this is also coming from the ANA as well, and the ANA stands for American Nurses Association. Okay, so what the ANA says is that the nurse to patient ratio needs to be decided within the hospital and not through legislature, sorry, can't say that. Anyways, so what they're saying is they don't want the nurses to feel like they are treating them as a number. They want them to feel like they are a nurse and not just a number that they're throwing out there, I guess you could say. So what the ANA wants, and I guess what the legislature's kind of decided for now, is that they really just want the hospitals to decide what they would like to do inside of the hospital. But that's kind of where the problem comes in. Not many hospitals have done that, but I'll get to that later. Anyways, so my second one is going into how these people do support keeping the nurse ratio safe, but they do not want to mandate it. They feel like every situation is unique, kind of like the previous one, the ANA, but this is a little different. They feel like every situation is unique. Sometimes you may need a mandatory ratio, sometimes you don't. And I agree with them a little, but I feel like there should be some sort of line drawn though. And then my second one is going to be the nurse's salary. You're going to have to pay the nurses for all the extra hours that they are working to keep that ratio safe. And that is quite a lot of money. I do understand that. So the average nurse ratio is about $66,000 a year. Anywhere, I think I read anywhere from 66 to 75 is kind of the average ratio right now. So if hospitals were required to staff more nurses, they would have to pay those extra nurses that salary. Also, another downside to this, to mandating a nurse ratio, would be the wait times. If hospitals are only required to have, let's say, 6 nurses staffed, and the hospital only had 6 nurses staffed that night, and say there was a lot more patients than there were nurses available to take care of those patients, and the hospital didn't want to call in another nurse, well, by law they don't have to call in another nurse because it's only required to have those 6 nurses, and those other patients would have to wait. And so that honestly is a very big downside. I do see that. I do see this coming into play a lot more in the doctor's office, I guess you could say, as seen as well in the hospital. And another thing that I'm going to go into now is going to be my supporting articles. And what I'm supporting is I think that there should be some sort of mandated ratio. I think that it is very unsafe if there's not. Things get in a rush, you forget things when you're so busy and you can't sit down to just think about it. So I do support a mandated ratio. One of my next topics that I'm going to be talking about is the nursing staff affects the patient outcomes. And I honestly have seen this firsthand. I know that the nursing staff levels do affect the patient outcomes. If you are understaffed and crazy busy and just running around with your head cut off, it is so hard to take. It is so hard to be able to take the proper care that you want to be able to take care of your patients without another patient complaining or something, saying that they're having too long of a wait time. And so I really do think that the outcome of a patient is affected by how many nurses are staffed, because you need to be able to take that proper time and care for that patient, because they do deserve it. They're paying for the health care that they're getting. They deserve to have the best health care that they can get, whether at the hospital or doctor's office or rehab or wherever they're at. They need to be able to get the right care. So the next thing that I'm going to be talking about is med errors. And honestly, med errors are a lot more common than you would think. Whether it be the nurses are getting too busy and report gets thrown off somehow. That happens honestly a lot. I honestly just had this happen in my hospital that I worked at. The nurses that were getting report, it was really busy that day. The report got thrown off. The nurse ended up putting in the wrong orders in the IV pump, and it did not end good. So things like that do happen a lot more when it is very busy, and that could be prevented by having more nurses staffed. Another med error that I've seen before would be if a patient needs to be turned and is not turned in bed at the right times, they will develop a bed sore. Also, another thing that I have came in contact with has been if a patient needs to turn and deep breathe. A lot of time that can get skipped, and then the patient can develop pneumonia, or they're not using the bottom half of their lungs, and that can develop into so many other things. So these are just all things that take time. They take a lot of time sometimes, and they can't be missed. So that is why I think that it is important to have the appropriate nursing staffed. The next is honestly really important to me. So nurses are taking care of everyone. They're always trying to help out, and they're who you go to when you need help. And they need to be healthy too. And when a nurse is understaffed, and they are running around and trying to lift patients and do this all by themselves, they get hurt and they get run down. And I don't think you want somebody taking care of you that's run down and has had no sleep in like 3 days, because I've been there, done that. It's hard. And I actually found a statistic that it is 30% less likely to develop any sort of issue when you have the appropriate number of nurses staffed. Nurses are way less likely to get injured. Sleep is honestly such an important thing. You can't even think straight if you don't have enough sleep. So I don't know why people would want somebody taking care of them that is so overworked that they haven't slept in days. I don't know. But anyways, so yeah, those are just some of the reasons, the supporting reasons that I think it is really important to have some sort of staffing ratio put in place that is safe. And I know that this can be a hard thing to find a solution for, because it's like, okay, do you have 6 nurses on and mandate they're there, and then only have like 10 patients, and then you have way too many nurses for that, So what I have came to conclusion is that there needs to be always a nurse on call, or even a couple nurses on call. And you know what? If you don't need them to come in, then you don't call them. So you have those nurses that are staffed there at the hospital taking care of the patients, and if they get in a bind and need extra help, and just say, hey, I am really behind and I need extra help, and we're not going to be able to do this the proper way if we don't have more nurses, that they could call those extra couple nurses. And so that way the hospital wouldn't be having to pay their salary all the time. It would only be if they were needed. And honestly, I feel like the nurses would be a lot happier too, because they're not going to be overworked and run down. They're only going to be called in if they need the help. And then another thing that supports this is that the hospitals would honestly be benefiting from this, because they would not have to pay the extra amount of money for those nurses that are staffed all the time. Anyways, I hope you guys enjoyed my presentation and learned lots. Okay, thanks.